We're going to go ahead and get started. I wanted to welcome everyone to the webinar. For those of you who don't know me, my name is Dr. Lauren Levine. I host the webinars. I moderate them. As always, we got a great turnout. That's because we have a great speaker, multiple hundreds of people that are logging in right now. I always start my webinars the same way, I hope everyone's staying healthy and safe out there. Commend you, as always, for being here this evening, continuing your dental education. With that out of the way, I'm only going to speak for a few minutes. I want to make sure that Dr. Madrigal can speak for as long as he needs. We always leave time at the end of the webinars for questions. We can't do verbal questions, obviously, with hundreds of people on the call. On your screen, you should have all see a GoToWebinar control panel. It's a little box there, a little place where you can type in and ask your questions. Feel free to ask them throughout the lecture. We oftentimes don't get a ton of questions because the content's great and it's pretty self-explanatory, but if something isn't clear, you want to ask another question, by all means ask it. We'll try our best to get to them at the end of the webinar. In the next few days, look for a couple of things. First off, this webinar is being recorded, so we will always send out an email with a link to the recording. So if for some reason you can't make it to the end, your kids are screaming, whatever, you're not going to miss anything. During the webinar, Dr. Madrigal is going to be showing some products and systems that he uses, which are exclusive to TDSC. I want to thank them for their sponsorship of the webinars. They are the ones that are bringing in these amazing speakers. They're working with Dr. Madrigal to develop the content that we know is going to be valuable to everyone. They also handle the continuing education credits for that. And I always get a ton of questions about CE. So I'm going to say it at least 2 or if not 3 times this evening, because I know some people are still logging in. The way that the CE works is that you have to be here for the bulk of the webinar. I think it's like 75 or 80%. You have to actually be able to see something on your screen. We've had times in the past where people just call in. This is a PowerPoint presentation. It'd be like going to a movie and closing your eyes. You have to be watching it. So if you're not actually looking at something on your screen, then you're not logged in, you're not registered. So you have to be logged in. When the webinar is over, there's nothing that you need to do immediately. There's no test or quiz or anything like that. I will be sending out a survey. It's an email that doesn't come with a link to the survey. The survey takes 2 minutes at the most to fill out. Once you fill out that survey, that will be sent to TDSC, and they will then know to go ahead and send you the CE form. That can take a few days, so keep an eye on your inbox. Sometimes it can take up to a week when we have a large turnout, but keep an eye on that inbox. If you don't have anything by like a week from now, by all means, feel free to reach out to me and I will follow up with them. So it gives me great pleasure to bring back Dr. Madrigal. He has lectured many times in the past for us. He's a general dentist who operates dental practices both here in California and Mexico. He graduated with honors from the University of South School of Dentistry in León, Guanajuato, Mexico, where he earned his doctorate of dental science. Since then, he's become a member of the faculty of the American Academy of Implant Dentistry, as well as the AAID Maxi course, which is in Asia. He's a member of the American Academy of Cosmetic Dentistry, California Dental Association, and the Stanislaus Dental Society. I've actually lectured there a couple of times. He's an internationally recognized lecturer who presents on a myriad of subjects, including implant dentistry, clinical photography, and minimally invasive veneers, and obviously lasers, which we'll be talking about this evening, throughout the U.S., Mexico, Abu Dhabi, India, and Brazil. With a focus on cosmetic and minimally invasive dentistry, he believes that paying attention to the details is what separates good and great cases. So, Dr. Madrigal, we are thrilled to have you back and looking forward to tonight's presentation.
Always great to be here. Thank you, Dr. Levine. And thank you everyone for joining us today in this webinar that's really going to be focused on 2 things. One of it's going to be technology, and the other one is how our treatment actually affects the patient systemically. So we usually think about dentistry and we think that we're just treating teeth or just maybe the tissue that surrounds the teeth, maybe just the mouth. And really that's a very huge misunderstanding, because what we do goes much, much deeper than that. So we're going to focus on how we use technology to treat our patients and also why this is so important. The objectives for today are going to be to formulate effective strategies in order for us to be able to educate our patients in screening and also laser assisted procedures. We're also going to be using technology and how to be able to integrate this into our practice workflows. And the two main tools that we're going to be focusing on is going to be the laser, which is the NV Pro 3 diode laser. And the second one is going to be the Visalite Pro, which is a cancer screening tool that we're going to use. So we're going to focus on these two different aspects of technology that we have available to us. And the reason for this is really because everything starts in the mouth. You know, it is the gateway to systemic health. Everything really goes into our mouth, and we are what we eat pretty much. But it's not just limited to that. Anything that happens around our mouth, anything that happens in our teeth is ultimately going to affect every single other organ that we have. And multiple studies show this now, how there's a systemic impact of periodontal disease in every other organ. So if we have inflammation, chronic inflammation around our teeth, we know that this chronic inflammation is not just going to stay in the mouth. It's actually going to go everywhere else too. So unfortunately, we have these bacterias that they're causing all this inflammation with these toxins that they're releasing into the bloodstream. But let's remember that the bloodstream isn't just in isolation. It's not like it's under a rubber dam. It is connected to the entire body. So this bloodstream with these toxins, these all these different neurotoxins that cause this inflammation, they're going to end up in the pancreas, in the heart, in our joints, in our lungs, and even in our brains. Alzheimer's disease is actually now being called type 3 diabetes. Why? Because it is caused by this chronic inflammation. So it would be a huge mistake for us as dentists to think that we're just treating a tooth or just treating the mouth when it goes so much deeper than that. So we need to start thinking like that. We need to start also educating our patients and letting them know that the importance of having a healthy mouth goes beyond just our teeth, goes beyond just a nice, bright smile. It's actually going to affect us everywhere else. It's going to affect how we have cardiovascular disease, if we develop or not diabetes, or the severity of diabetes, respiratory diseases. For a long time, we've already known that pregnancy complications are directly related to periodontal disease. And how many times do we have patients come into our office, maybe a woman that has been coming to our office for many years, and all of a sudden we see this huge spike in inflammation around their gums. We see gingivitis, we see more plaque buildup, and we don't understand why. But then we realize that it's because she's pregnant. We have these hormones that are actually making it easier for inflammation to occur. But the problem is that if we're not treating this inflammation that's caused by the pregnancy, that will ultimately affect our periodontal tissues, it's gonna turn into just a cycle where this vicious cycle is gonna be causing more inflammation to the gums. Then the gums, we're gonna have more bacteria. They're gonna produce more toxins. That's gonna go into the bloodstream, which in turn is gonna cause more inflammation. So we know that all these complications can not only affect the mom, but they will also affect the child. So we know the importance of having a clean mouth. We know the importance of having something that's not going to be causing more and more inflammation throughout the whole body. So if we are able to treat our patients as a whole, not just treat teeth, that's definitely going to benefit not only the happiness of our staff, but also the happiness and well-being of our patients. And the great thing about dentistry is that when you have a happy staff, when you have healthy patients, it always reflects on the profitability of your office. So at the end of the day, we're all running a business here. But the great thing is that we don't have to be focused on the money aspect. because the money will come as long as we're doing things for our patients. And if we're using all this new technology that's available to us, all this information that's available to us, then we're going to be able to deliver that. And overall, we're going to have successful practices. So all of this is going to affect, again, every single organ, whether it's Alzheimer's disease, diabetes, arthritis, cancer, all this is connected. It's not in isolation. So we know now that it's all connected. But what can we do differently in our offices? Well, not just recognize, not just know that it's a problem, but use the tools that are available to us now to treat this problem. And specifically today, we're going to be talking about two different tools that we have. One is an Envy Pro laser, and the other one is a Visalite Pro. So both of these handheld devices, really easy to transport, are going to help us give our patients a healthier lifestyle and overall healthier systemic health. Okay. All right. So really quickly, what is a laser? Laser is just light amplification by stimulated emission of radiation, which, big words. It really just means that it's going to be a light that's going to be focused, and because it's focused, it's going to cause this change of temperature. It's going to cause heat that's going to vaporize tissue, or it's going to cause some biostimulation. And there's different types of laser. You have soft tissue and hard tissue laser, but really we're going to be focusing just on the diode soft tissue lasers. And we can do so many different procedures just with this soft tissue laser. The great thing about this is that it's not going to affect any of the bone structure. It's not going to damage any teeth. It's not going to damage any implants or crowns or any restorations. It is going to be focused only on soft tissue. And the reason for this is that this light can either be reflected, transmitted, scattered, or absorbed. We're going to be focusing mainly on the absorption of this laser energy. So it is absorbed either through water pigmentation, like hemoglobin or melanin, and when it's absorbed, it will increase the temperature, and that's going to allow us to cut, coagulate, cauterize, and sterilize everything. So this is how we can use the laser. We can avoid using a scalpel to cut because we can do that now with the laser. And not only is it going to cut, but we're also going to have blood control. Is going to cauterize the nerve endings, which means that all these neurochemicals aren't going to be released, which means less inflammation, less pain, and we're also going to be sterilizing the wound edges. This means that we're going to have faster healing, which is also something that we want. So what is the difference between a traditional method like a scalpel and the laser or an electrosurge? Well, we see that all of these have benefits. They're efficient to remove soft tissue, but when we're talking about hemostasis, when we use a laser, we're not going to have bleeding everywhere, which means that we're also not going to be needing sutures. It's safe to use around implants. It typically requires no anesthetic. Sometimes we use a little bit of topical, but it's actually going to be very rare. We have a reduced post-op pain. Since we're cauterizing those nerve endings, we're not having all the histamine being released. And since it's not being released, it's not causing all this inflammation, which in turn just means that it's going to be easier for us to have a faster healing time. We're not going to have reduced swelling, discomfort, and we're not going to use any sutures. Why? Because there's really not going to be any bleeding that's going to be occurring. So just really quickly, there's two different ways that we can use a laser. One is going to be initiated and the other one is going to be non-initiated. And all this means is that at the end of the tip, it's either going to be blackened or not blackened. So you can do this either with a Sharpie or with some articulating paper to initiate it or not initiate it. But overall, it's going to be the same laser tip that you're going to be using. And one of them is going to be used to cut, and the other one is going to be used to biostimulate. So just think about this. Whenever you want to cut tissue, you want the tip to be initiated. And I'll show you an example of what that looks like in a little bit. The laser also has two different settings. One is going to be a continuous wave, and the other one is going to be a pulsed wave. So when we're using continuous wave, that means that the laser that's going to be emitted, that laser energy that's going to be emitted, is always going to be exactly the same. So when we're thinking about cutting with that initiated tip, we want that energy to be consistent. We want it to be constant. So we don't want it to be fluctuating. We want it to just always be releasing as much energy as possible without having that tissue cool down. Because at the end of the day, what we want when we're doing gingival recontouring or frenectomies or laser troughing or soft tissue crown lengthening, we want to be cutting tissue. If we don't want the tip to be initiated, that's because we don't want to cut any tissue. So when we're using this for laser bacterial reduction or aphthous ulcers or canker sores, we don't want to cut the tissue. So since it's not initiated, we also want to use a pulsed mode because we don't want that tissue heating up so much. We just want the benefit of having the laser energy. So if we're using a continuous wave, the average power at 1 watt would be, well, 1 watt because it's going to be continuous. If we're using a pulsed mode at 1 watt, it will actually turn on and off, on and off, on and off half the time. That means that we're going to be using half of the energy, which is great when we want to heat up that tissue too much since we don't want to cut it. So for biostimulation, we want to use that pulsed mode. For cutting, we want to use that continuous wave, okay? All right, so why is this important? This is important to know because we want to promote healing. When we're using the laser, we're causing an injury to some cells, right? But if we're using the laser, we're going to be using less anesthesia. We have minimal bleeding, really, no tissue scarring, which means it's going to be healing faster. And if something heals faster, well, we're going to have minimal post-operative discomfort. And overall, since this is so precise, since the laser is so precise, we're going to be having predictable results as well. And we have many different procedures and applications that we can use this. It's simple to use. It's really the size of a Sharpie. And because of that, we have great patient acceptance. Since it's so easy to use, minimal anesthesia needed, minimal bleeding, no sutures, it just makes it really easy for an office to adapt this. And the laser that we're releasing into these tissues is going to promote healing. But this is not just because it's less invasive. It's not just because it's more precise. There's something else going on with laser energy that's helping this healing go faster. And that is called biostimulation. So what the laser energy does is that it actually biostimulates fibroblasts, which means that it's going to promote more cell growth for this fibroblast. And we know the fibroblasts, they're going to produce more collagen. So when we're using this low-level laser therapy, we're actually increasing circulation, collagen formation because of those fibroblasts, and also bone activity is going to increase. So the great thing about lasers is that all of this is going to stimulate faster healing. And there's many different reviews that we can see in the literature about how using low-level diode lasers actually helps with not only periodontal disease and healing, but also, when we're talking about maybe around implants, when we're talking about wounds, when we're talking about removing lesions, it's so much faster for us to see healing when we're using a laser instead of using something that's not going to be as precise like a scalpel or an electrosurge. So this is all great, but really in office, real life, where do we use the laser the most? And that is going to be in hygiene. So every single day we use this laser in our office. So why do we do this? Let's go back to the beginning. We said that the mouth was really the gateway to everything else, to systemic health. The mouth is where we have all these different bacteria, some healthy, some not so healthy. So what do we do with the laser? Well, we want to reduce that concentration of bad bacteria that are around the gingiva that are causing this chronic inflammation, that are releasing these toxins into the bloodstream. So what do? In hygiene, we can use pocket decontamination, which means that we're going to eliminate the bacteria that are around in those gum pockets, which is going to help faster healing again. We're going to use this to restore this gingival health. It's going to be minimally invasive, and it also helps with pain reduction and comfort. Why? Well, because all of this low-level laser energy is helping us heal much, much faster. So we have SRPs that are going to be enhanced. And I'm going to show you what we do in the next 2 slides. I'm going to show you how we actually use this, how we implement this in our office. But before that, there's 3 different procedures that are used in hygiene that can use the laser. The first one is going to be laser bacterial reduction, which is going to be used in conjunction with SRPs. Sulcur debridement, which is also going to be used after we're done with the SRPs. And something that's actually sometimes overlooked is desensitization. Now, a patient comes in and says, I have just, especially in those class 5 areas of the teeth, I just have really sensitive teeth to hot and cold. Or patients who have had bleaching, I just have really sensitive teeth. Something that we can do is use the laser. We do a prophy first, we apply some fluoride, and then with the laser, we go around each tooth. And what we do is that we're kind of just obliterating this fluoride into those dentinal tubules. So we're sealing that off, and we're not having that hydrostatic pressure now in the tooth when we're having hot and cold, or with whatever fluids that the patient is drinking. And that's going to cause that sensitivity to just greatly reduce. And it is super fast, and it's instantaneous as well. So there's other common procedures that we use. The ones on the right are going to be without cutting any tissue. The ones on the left are going to be the ones that we use the laser to cut tissue. So like laser troughing, class 5 restorations, crown prep impressions, gingivectomies, frenectomies, implant recovery, or fibroma or lesion removals. We can use it for all this. We can also use it for laser bacterial reduction, aphthous ulcers. But really, what do we use this for every single day in our office, multiple times? And that is going to be with laser assisted scaling and root planing. So when we're using traditional SRPs compared to laser assisted SRPs, we see a great change, not only in the recovery and the post-op of the patient, but also in the overall treatment results. We see greater pocket reduction. We also see faster healing, and we see overall more patient compliance. So what does this do? The laser-assisted SRPs, what the laser does is that it's going to vaporize that bacterial biofilm before we even start the SRP. It's also going to reduce the risk of infection. Why? Well, if we have less bacteria, we're going to have a less likelihood that we're going to have an infection. Pain and discomfort, when we're using the laser, it's also going to be cauterizing those nerve endings, which means that it's going to reduce, post-op pain. We're going to reduce those toxins that are being released into the bloodstream as well. So how does this work? Every single patient that needs an SRP in our office, which, the ADA tells us we have around 60 to 70% of our patients of adults that are actually diagnosed or should be diagnosed with some sort of periodontal disease. So this treatment is offered to every single one of them. The first thing that we do in our laser-assisted SRPs is we do bacterial reduction. So we use the laser before we start our SRPs, and we go around every single tooth with the laser. This is going to reduce inflammation. It's going to promote also blood clotting, which is going to minimize the bleeding during the treatment. But it's also going to be biostimulating this tissue, and it's going to be killing off as much bacteria as possible before we even get in there to disrupt all this plaque buildup. After this, and this is all in the same visit, after this, we do scaling and root planing. So this is just traditional scaling and root planing, you know, with an ultrasonic, and then you finish off with your curettes. So just like you would do traditionally. But when we're done with the scaling and root planing, we bring the laser back again and we do the circular debridement. So what this does is that it's going to remove selectively that diseased epithelium. So how does this do this? How does this happen? This happens because diseased epithelium or diseased tissue tends to be darker in color. And if you remember at the beginning of the webinar, we said how laser energy was actually attracted to pigments. So if we're having tissue that's diseased, it's actually going to have a more of an affinity to that tissue, and it's going to be able to remove it. So this is going to allow us to have healthy tissue to regenerate. So it's going to be a lot easier for us to help the patient reduce those pocket depths. So this is actually going to be great for the patient. And the best thing about this is that it can actually be performed by a hygienist in many states. So that is actually one of the best benefits too. I know in California we can use it. We can train our patients to, our hygienists, to actually treat our patients. And since the hygienist is going to treat our patients, that means that we actually have less time that we have to spend in the chair while the patient is still getting great treatment. So something to keep in mind. You know, the benefits are so great. So there's really no reason why you shouldn't be using the laser in your office. At least offer it to every patient. Sometimes it's very difficult for us as dentists to offer these treatments to a patient, you know, but we shouldn't be afraid of this because the benefits are great. So, you know, I said already, and I keep saying that we have great benefits. You know, the dial laser is going to eliminate the bacteria. It's going to reduce inflammation, promote faster healing with biostimulation. But let's see some real life results. Let's take a look at this case right here, where we have this patient with really deep pockets. We have 9mm pockets. And what can we do here? Well, we did what we do to every single patient in our office. You know, we offered her SRPs that are going to be laser assisted. So what do? We do the laser first, then we do our SRPs, and then we go again with the laser. And what we see is that the treatment is highly effective. So this is the patient at her 6-month checkup. We see that the pockets actually have reduced to 3mm, from 9mm to 3mm. We see that there's really no inflammation around the gum area anymore. We see how before it was really red, really puffy, and that's just completely gone. But we have all this technology now where we can offer this to our patients, you know, and we just need to make sure that we're using the tools. In this case, we also use something called Peri-Restore, which is hydrogen peroxide gel that Denmed also offers. But you know, it just means that we have to use the tools and the technology that's available to us. Let's see another treatment. So aphthous ulcers. We see right here we have an aphthous ulcer that we're going to treat with the laser. You can see that the tip of that laser is not black. It's not darkened. So that means that is not initiated. Why? Because we don't want to cut tissue. So we're just going to go with our laser around this area right here. And, you know, that's going to promote faster healing. It's going to kill any bacteria that can be right there on the surface. It's going to promote faster healing with that biostimulation. So that patient's going to heal really fast. You know, and all this also means that, you know, we have benefits in hygiene that are going to be beneficial for our office. Also, it's going to make it more profitable. So these are procedures that you can be doing for your patients. You're doing a benefit for the patient, and at the same time, it's something that you can charge for. So there's many more applications that we can do, and I'm just going to do it really quickly because we don't have so much time to show you some of these cases that we can do. So we have tissue retraction, aphthous ulcers, which is something that we saw already. We can do frenectomies, really easy frenectomies, and I'll show you one of the videos that I did on a patient right here. Gingivectomies, lesion or fibroma removal. So there's so many more applications. Anything that really requires precise cutting, we can do it with the laser. So let's take a look at this case right here. Especially take a look at that tooth number 7. I mean, that tooth was prepped super, super deep before. So packing cord right there is really just not viable. It is not an option. Why? Because it is just too deep. There's no way that I can get cord all the way down there to retract that tissue without having to cut that tissue. But if I use a laser, I can just do laser troughing very gently around the tissue, just discovering that that margin, take my scan, and then send that to the lab. Now, what happens if I were to do this with cord, which I know we've all done? You know, we pack one cord, then we pack a second cord. There's blood everywhere. Let's say we take an impression, we take out the impression, and there's some air bubbles. Well, unfortunately, you brought all that cord with you already, so you have to pack it again, and it is just a nightmare. If we're using the technology that we have, if we're using this laser, we can just trim around the gum. If we're taking an impression or a scan, we can see if the impression or the scan came out right. And if it didn't, we really just retake it. But there's no bleeding. There's not going to be any cord that needs to be packed, and you're going to have really clear margins. So you can see, well, how effective is this and how is the outcome of this patient? Well, let's take a look at this. This is a patient 1 week post-op. You can see that the tissue is completely healed already. Why? Because we only took about 1 millimeter around the tooth. We really didn't cause any recession. We didn't cause any more damage to the tissue. We simply caused a little bit of separation from that tissue to the margin so that the lab can clearly see it. Let's take a look at a lesion removal or a fibroma removal. We have this patient right here where she's had this, it was a mucocele that actually turned into a fibroma. She's had it for about 6-7 months already. So what do? Well, we just take our laser, we remove it. You can see that there's really no bleeding anymore, which means that we don't need any sutures. Since we don't have any sutures, that is really just going to be like if the patient bare her cheek a little bit. In a week, this is what we have. Completely healed. We see a little bit of red around that area, but it's super, super minimal. The great thing about this is that if this was a case that was done traditionally with a scalpel and a blade, what we'd have to do is put some sutures. In a week, the patient would come in and we would remove sutures, and then really let the healing continue. When we're using the laser, it's just so much faster. Treating class 5 restorations, where we have subgingival decay, that we see this all the time, especially in cases that we need to have good isolation. We can't have blood, we can't have that curvicular fluid invading our restoration. Well, we can easily just take our laser, remove the tissue non-invasively, and do our restoration. And this is the magic of having these tools available for us, but also using them. All right, so let's take a look at now at frenectomy. Frenectomies are something that usually as dentists we tend to run away from because they can be a little bit scary, a little bit daunting. But with the laser, it is super, super easy. So this is just a frenectomy that we're doing. So we did numb this a little bit just with a little bit of lidocaine, and it's as simple as just trimming away that excess tissue that we have. You can see that the laser tip is darkened, so it's blackened. That means that it is initiated. So again, we can do this just with a Sharpie or with some occlusal paper, articulating paper, and that's it. But this is what we have. This is how fast you can do a frenectomy. You can see that there's no bleeding right there, absolutely no bleeding. And the great thing about this is that the patient is going to heal really, really fast. So when we see the patient back in a week, all this area is just going to be completely healed already. There's not going to be any need to remove any sutures. And we have great patient acceptance. So whether it's a lingual frenectomy or a labial frenectomy that you're doing, it just makes your life so much easier. And this is a procedure that everyone listening to this webinar can do. So we have benefits in dentistry. We have other procedures that we can be doing, gingivectomies, frenectomies, that we can be charging for this. These are procedures that can bring in more revenue to your office. But not only that, the patients that you're treating, they will also recognize that your office is an office that uses technology, is an office that is always looking to improve, that are using the latest that it needs to be used for their health, which overall just brings more confidence that those patients are going to have in your office. Let's take a look at crown preps. Sometimes we have tissue that's invading. Yeah, we can use a cord. We can also use a laser just to separate a little bit of that tissue. And very simply, we can take our impressions, bring our crowns back, and in this patient, we did some rubber dam isolation, and we delivered 4 Lumizier crowns from Denmat. But this is the week after cementation. And we can see how great the tissue has already responded. Why? Because we are using minimally invasive techniques. So these are just some procedures that we have to show you, but there's really all these different procedures that you can do. Really anything that you can think of cutting, if you're cutting soft tissue, you can do it with the laser. So the great thing about the laser is the NV Pro 3 is that it has these presets. So you don't have to think, all right, do I have to do a continuous, or do I have to use how many watts, or is it initiated or not initiated? There's already all these presets that come in with your laser. So you really just pick the procedure, and automatically the settings are going to be updated in your laser, and you can just start trimming away. All you have to do is either initiate or not initiate the tip, and that is it. You are ready to go. So it makes it super easy. Another great thing is that it's mobile. This thing is the size of a Sharpie, so you can move it from one op to another op to another op super easily. So it's wireless. It's just a great tool to have in your office. And there's also training that's going to be included whenever you get one of these. You have CE that's included for your training that comes with the laser. So super simple to use, and really a tool that every office really must have. Another thing that we must have is really going to be dealing with cancer awareness. So an oral cancer screening really can save a patient's life. And today, if you're not doing cancer screening in your exams, if you take something from this webinar, is that we need to always do a cancer screening on every single patient, but not limited to what the naked eye can see. We have the technology now to where we can see minor changes in the cells. We can see cellular dysplasia now that can, just be early detection of cancer. And that is what we want to see. We want to be using everything that we have in our office in order to really help save our patient's life. Remember, this is a systemic issue that we're dealing with now. We're treating the entire person. We're not just treating teeth anymore. So just some statistics, there's about 60,000 new cases of oral cancer. This also means that we have about 12,000 deaths a year in the United States, every single year, just from oral cancer. And this is something that a lot of times can be detected early. And the sooner that we detect it, the sooner that we can treat it. The sooner that we can treat it, the more likely that that patient is actually going to survive. So out of all these cases, we have 60,000 cases that are being detected. Let's say that we bring that up to 100,000 cases, and instead of 12,000 deaths, we're able to bring that down to 5,000 deaths. So it's we have the technology available, and it's really a disservice that we're doing to our patients by not offering this treatment to every patient that really walks into our office. You know, we see that the cancer diagnosis that's being diagnosed in the United States, it's increasing for about 1% per year, which is good as long as it's being diagnosed earlier. What we don't want is we don't want these cases to go undiagnosed. We want to increase the amount of diagnoses that are happening, but unfortunately, this doesn't just mean that more people are diagnosed with cancer or that more doctors are doing the diagnosis. What it means is that, you know, it's becoming more and more prevalent. You know, it's actually increasing. So we have to use the tools that are available to us. And this tool is a great thing to incorporate to your office. Again, why? Because it's just so simple to use. It's so simple to implement. It takes about, you know, 1 minute, 2 minute stops of you doing some cancer screening for a patient, and that can really save a patient's life. You know, we have oral cancer and HPV that is highly related. You know, we have alcohol that's going to increase it. We're going to have smoking that's going to increase it. And luckily, smoking is actually has decreased tremendously in the past decades here in the United States. But we still have HPV that's highly related to oral cancer, drinking as well. You know, and this means that, you know, we're going to have more and more cases that can be diagnosed. We can see that the FDA estimates about 70% of cervical cancers are actually associated with HPV 16 or 18. And we can see that this is highly related too with the regions in the mouth, that is highly related to actually having this cancer in the oral cavity as well. And this is something that we can detect. Not only HPV, but we also see that periodontitis is highly related to oral cancer. Why? Because this all causes chronic inflammation. And where there's chronic inflammation, we're going to have a higher risk of having these cells just, you know, start losing their characteristics. They're going to start having metaplasia, start having dysplasia. You know, and this is something that we can easily detect now very soon, at least earlier. So we can see that the main areas that are actually going to be detected with cancer, or where we see more of these cellular changes occurring, is going to be in the lip, you know, sometimes in the tongue, and then in the floor of the mouth. But the sad thing is that a lot of these, when we're detecting them, you know, they're actually too far along. So when we're detecting, let's say, oral cancer in the lip, and it's a stage 4, you know, there's a 52% chance of survival. So if it's early stage in the lip, in stage 1 or 2, we have a 93% chance of survival. This means that, you know, the sooner we detect this, the sooner the patient can be treated, and they can have a very good prognosis. So early detection is critical. We need to stop, you know, just seeing our patients as we just see their teeth and that's it. No, start looking for this. Start treating every patient the way you would want yourself to be treated, the way you would want your family to be treated. You know, oral cancer, yeah, it's expensive. It's difficult to treat, but it's also something that's going to affect our practice. You know, really, it's incredibly common now that dentists are actually being sued for not detecting oral cancer. So the average settlement for failure to detect oral cancer in the US is over $1 million. And then this is not something that needs to move us in the sense that, all right, I'm going to start detecting cancer because, or looking for cancer because I don't want to get sued. No, that should be in the back of our minds, yes. But the number one reason should be that we want to make sure that our patients are being diagnosed because we want the best treatment for them. We want them to live long lives. Even though, yes, malpractice lawsuits can come, that should be a secondary, that should be in the back of our mind. The main thing is that we want to increase early detections because we want to increase the survival rate of our patients. You know, if we have a late prognosis, 57% of them will be alive in 5 years. This can be greatly increased by us just detecting it early. And we have no excuse. There's so many tools available now that can be used. Insurances, most of these insurances will cover oral cancer screening. So whatever tool that you're using, we just want to make sure that we use something to detect this. So again, in our office, we're using this Visalite Pro. The reason for this is, it's just the latest in innovation. It has fluorescent technology, so we're able to actually see with our eyes what's going on. We can see a change. We can see where we have normal cells and where we have abnormal cells. And we want to catch this where we have this dysplasia, where it's really early, where we see an abnormal growth of cells that is really early, but it's not cancer yet. That's when we want to catch it. That's when we want treatment to start. We don't want it to be to where we have severe dysplasia or metaplasia, or worse, when we have a carcinoma already. We want to make sure that we're detecting this as fast as possible. So what does this look like under the Visalite Pro? It's a fluorescent light. So when you're looking at it, it's going to be green, and we can look for really dark areas. So this is what we're going to see. This is a normal flora of the mouth. This is normal variation because it's bilateral. We just see some inflammation right there, but it's bilateral. This is actually healthy. We can also see that whenever we have something that's bilateral, that's a good thing, right? The problem occurs when we start seeing something that's only on one side. So we can see this dark area on that right side of the slide, the left side of the patient. We can see that if we looked at this through the naked eye, we really are going to miss it. At least most of us are going to miss it. But if we look at this through the Visalite Pro, it automatically jumps at us. And when we have other lesions, we see that they actually, they jump at us. Why? They turn dark under this light. We see mild and moderate dysplasia right here. Now, this is something that can still be treated. This is in the early stages. What we don't want is we don't want something to go undiagnosed just because we can't see it with the naked eye, because we have these tools available to us to catch carcinoma, to catch severe dysplasia. So this is really what we do.
Okay, so now we're ready to start our clinical.
I know this it's only going to take about 2 minutes. This is the screening that I did on my assistant, and I'm going to show you what it looks like through the lens. So we want to actually be seeing the roof of the mouth. We want to be seeing that underneath the tongue. We want to be seeing the cheeks. We want to see the borders of the tongue, and we also want to see the lips. These are all the areas that we want to check. Overall, just the entire oral cavity. So we take a 2x2, we move the tongue to one side to see those lateral borders. We're going to move it into the other side to see the other side. We want to see as far back as possible, because that's usually where we have more dysplasia occurring, as far back as possible. We ask the patient then to raise her tongue, because we want to see the underside of the tongue, and we also want to take a look at the floor of the mouth. So all these areas we're looking and we're trying to detect to see if there are any changes that are going to be unilateral. We're going to check the lips as well, and just overall, just make sure that we're checking every single aspect of that oral cavity. Remember, carcinoma can show up really anywhere, and the sooner we detect it, the sooner we can also get it treated. So we do a visual examination, we do patient history, and we do Visalite Pro. We do the assessment for fluorescence, and we document. And if needed, we have a biopsy. Now, you don't have to do the biopsy yourself. You can just refer it if you need to. But the bottom line is that, a late diagnosed a late diagnosis is going to lead to poor survival. The faster we diagnose, the better the chances of survival that the patient has. We want to make sure that we're offering this test to help mitigate malpractice risks as well. Why not? Yeah. But what we want is we want to be taking care of our patients. The best practices is that we screen everybody, and the common charge that we have in the U.S. is really about $25 to $50 per screening. Every patient won't accept it. Every insurance won't cover it, but it's offered to every patient. And to be honest with you, even the patients that deny it, that they don't want the treatment, we have them sign for it. We have them sign that they didn't want it, but we actually do it anyways. At least once a year, we treat our patients with the Invisalign Pro to make sure, just to make sure that there's nothing going on right there. I would much rather, not charge $50, $25, but have that peace of mind that my patient is being screened, that my patient is being taken care of. And at the end of the day, this just comes down to patient education. We want to make sure that the patient knows and appreciates what you're doing for them, that we're screening them, that we're actually caring about them. This in turn is going to turn to the three main focuses that we have in our offices. And that is a happy team is going to lead to happy patients, which just consequently is going to lead to a more profitable office. So with that, I want to finish. I want to thank you everyone for joining us. If you have any questions, I know it was a lot of information. We went by really, really fast, but please feel free to reach out to me, whether by sending me a message through Instagram or shooting me an email. I'll be more than happy to answer any questions that you have and help you in your practice and just overall just treat our patients a little bit better. Thank you so much.
Thank you so much. As a reminder there's a special offer. I'll talk about that. So for those of you who may have popped on a few minutes late, a couple things I went through. First, the webinar is being recorded. So you should be sent a link to be able to view that sometime in the next day or two. As far as the CE credits are concerned, you have to have been here for most of the webinar. I don't remember the exact number. It's like 75, 80%. What will happen is that sometime this evening, I will send you, all of you who qualify will be sent an email with a link to a survey. It's a very short survey, 2 or 3 minute survey. Fill that out. That gets sent on to TDSC, and they will then send out the CE forms. That process can take a few days, up to a week or so. By all means, feel free to reach out to me if you have any questions or concerns, or you haven't gotten your CE by sometime next week. One of the reasons I love working with TDSC and other companies like them, like DenMat as well, is that they will always offer a special to say thank you for joining and attending the webinar. The offer tonight is for $200 off the NV Pro 3 micro laser. Plus, you can get an additional 10% on any DenMat product, including the Invisalign Pro, which Dr. Madrigal just talked about for oral cancer screening. That offer is good until the 24th. One of the reasons that I like working with companies like TDSC is they say what they mean and they mean what they say, which means if you call them on the 25th, well, it's a Sunday, they're probably not going to pick up. But if you contact them anything after the 24th, you will not be able to take advantage of that special offer. So I would highly recommend that you take advantage of it while you still can. Only one question so far, and I'll certainly encourage people, if you have a few more questions, by all means, we have about 5-6 minutes before the top of the hour. So Dr. Madrigal, in the scaling and root planing cases, are you doing laser first, then scaling and root planing, and then laser again, and all on the same day, or what's the protocol?
Exactly, yes. And some insurances will actually only cover SRPs if you do half of the mouth one day and then half of the mouth in a separate appointment. But we do the laser before, and then we do SRPs, and then we do the laser again at the end. Yes.
Okay, great. Well, I had said in the beginning of the webinar that with a lot of time with these webinars, when Dr. Madrigal does, here we go. Here's another question I was going to say, because we oftentimes don't get a ton of questions because the content's very well presented and very self-explanatory. for the Visalite Pro, is it only for oral cancer, for the oral cavity, or can it be used on other areas on the body?
Nope. I'm sure that it can be used for other areas of the body, but I'm not sure if it's FDA cleared for that. I'm really not sure about that. And I say it can be used for other areas of the body because I've used it on myself. I actually had, just on my leg, a lesion that didn't look too good, and it was probably from the sun. So I screened it, and it did not look like other areas on my. It was on my calf, and actually did get that removed, get that biopsied, and good thing that I did. So, but again, that is not. I don't think that is FDA approved. But as dentists, we should probably just stick to using it in the lips and mouth oral cavity.
Okay. Is there a minimum age at which you'd start screening?
We screen everyone. That's every single patient that we have. We have very few pediatric patients in our office, so that's why we really just screen everyone. Cancer is obviously going to be a higher risk for patients that are older, but we want to use it at least on every single adult at least once a year.
Okay. When you initiate the tip, do you have to initiate a certain length of the tip for skin and root planing? Does it depend on the pocket depth, for example, or is it always just the same, just millimeter or two, and that's it?
So there's two different tips that we have available to us. We have the 5 millimeters and we have the 7 millimeters for the NV Pro 3. We tend to use the NV Pro 3 7 millimeters for perio, especially with those patients that have deep pockets for SRPs. And then when we're doing perio maintenances, we tend to use a 5 millimeter. When we initiate the tip, we're using usually the 5 millimeter, and that's really, remember, you're only initiating the tip to cut tissue. And it's really just like the last third of the tip that has to be initiated. Obviously, if you initiate all of it, it's going to give you a little bit more focus on the laser energy to cut faster, but we find that that's usually not necessary. It cuts really well, really fast.
Okay. Any contraindications to using the laser? Heart patients, joints, active infection, anything like that?
Not at all, no. So remember, this is just light. Since it's light, it's not going to affect any patient that has a pacemaker or any allergies to any medication. It's not going to affect implants, crowns, restorations. It's really a soft tissue laser, and it's just light, so it's really just heat. You can use it on newborns. I've used it on newborns to do frenectomies, like straight out of the hospital. And I've also used it on patients that are 100 years old for any single patient. We can use it. There's no contraindications for really anyone.
Okay. Do you ever anesthetize these patients, or are they typically done without anesthesia?
Oh, we do. We definitely do sometimes, especially like when I see that I'm gonna be cutting quite a bit of tissue, like let's say that frenectomy that I showed you, that patient I did numb. I did put a little bit of lidocaine. When I'm cutting a fibroma, I usually put a little bit of anesthetic right there too, just a little bit of lidocaine as well. But if I'm doing, let's say, like a crown prep on a tooth that has a root canal and I'm not numbing for the crown prep, I usually tend not to numb for the laser procedure either. I will use a little bit of topical gel, but that's it. I'm not actually giving any local anesthesia.
Okay. Well, we are at the top of the hour, which is good because we're out of questions as well. So anything you'd like to say before we call it a night?
Just thank everyone. We have these two great products at our disposal, and even if you're not using these products, you have to use something in your office, especially for cancer screening. It's a tool that just it really just, all of these just pay for itself, and the benefit that you're getting to your patients is just, it's something that goes without saying. And hopefully you never diagnose one of your patients with cancer, but unfortunately, if you're using this correctly, sooner or later you're going to happen. It's happened to me already. One patient was stage 4 melanoma, and he got diagnosed. He passed pretty soon, but I've had other patients that I've diagnosed early as well, and they've gotten treatment and everything has been fine. So just get ahead of it, get ahead of cancer and use what we have at our disposal.
Great advice. Well, as always, I want to thank you for joining us, for sharing your valuable information. We always get great turnout when you're here, so we want to keep bringing you back as long as you're willing to come back. And thank you to TDSC and DenMat for sponsoring the webinar. You can see the special that's been on the screen for the last few minutes. Highly recommend you take advantage of that. It's good for another 4 days. I want to thank TDSC as well for bringing in the speakers and the content. We've done a number of webinars with them, and I really appreciate their support of these webinars. Final reminder, the webinar is recorded. The recording should go out sometime in the next day or two. CE credits, you'll all be sent for those of you who qualify, as long as you've been here for most of the webinar, I'll send that link later tonight for the survey. Take a couple of minutes, fill it out, and then once that's done, you'll be sent the CE form within a few days. We do these webinars on a regular basis, so all of you who are here this evening are on the invitation list for future webinars. So we look forward to seeing all of you on our next webinar. Please stay safe and healthy out there, and thank you all for joining us. Good night, everyone.